Are you a woman over 40 that finds sleep challenging? If so, you are not alone. Did you know that up to 60% of women in midlife have difficulty with their sleep? Yep, it's so true. And I'm sure you know how important sleep is for your well-being, especially during this important transition in your life like menopause. So together, let's explore how we can navigate these changes with confidence. Who am I? Well, I'm Dr. Val, an integrative sleep medicine physician and women's sleep expert, here today to discuss a couple of reasons why you're having difficulty with your sleep through this process. Number one, during perimenopause, estrogen and progesterone levels really fluctuate. And then as we go into menopause, which is a year without our periods, they decline to almost undetectable levels. And these changes can really affect your sleep pattern, making it tricky for you to get the deep and restful sleep you deserve. So research suggests that hormonal shifts may lead to lighter sleeps and even more awakenings at night. You know, those 2-3 o'clock awakenings can actually be from a hormone-related process. Having lower levels of these sex hormones can also increase your risk of developing obstructive sleep apnea. And this is something that I love talking about because a lot of women don't realize that this could potentially be going on to them. Some of the research shows up to 90% of women who have obstructive sleep apnea are undiagnosed. The classic symptoms are snoring, gasping, choking, and feeling tired throughout the daytime. But guess what? Up to 40% of women don't present with these classic symptoms. What do women have? Well, more disrupted sleep. Maybe they report more insomnia, nightmares, waking up with a headache, and also report feeling more fatigued, and sometimes even with mood disturbances. Right, ladies, if you don't sleep, sometimes mood is one of the first things to go. So if this sounds like you, please talk to your doctor about getting a sleep study. However, if you want to skip that visit with your doctor and you want to just get a sleep apnea kit mailed to your house, you can check out Lofta. This isn't a sponsored video, but they do have a program where you can have a home sleep apnea kit just mailed to you. One word of advice though, if you do the home sleep apnea test and it's normal or read as inconclusive, I do suggest getting the in-lab test. Is really the confirmatory test. That's called a polysomnogram. It's just an overnight test in the lab that just has more parameters such as looking at your brain waves to tell us if you're sleeping well or not. In my day job as a sleep medicine physician, I do see countless of women who report having insomnia and fatigue, and really what it comes down to is that they have obstructive sleep apnea that isn't well controlled or isn't even treated. And so now once we get them on treatment, they can sleep through the night and have so much more energy throughout the day. Another factor that can contribute to poor sleep during perimenopause and menopause are those infamous hot flashes and night sweats. They can be so disruptive, and sometimes you may not actually be woken up out of a sweat or needing to change your clothes, but your body temperature may just rise, and this can be enough to wake you up and disrupt your sleep. Part of what happens in our body and our brains when we sleep is our body temperature actually lowers, and having this drop of estrogen leads to issues with your temperature and can cause you to have a hot flash. So this is a huge deal, and we'll talk about some treatment options a little bit later. Another factor that can disrupt your sleep is melatonin. Melatonin is your body's natural sleep hormone. It gets released in response to darkness. And what can happen as we get older, some of the research suggests over the age of 55, we have a decreased release in our melatonin, and this may also relate to causing some of those tossing and turning at night or having just a hard time staying asleep. Another huge factor that we know can impact women's sleep during perimenopause and menopause are mood swings and stress. It's really difficult to sleep when you have something on your mind, when you're upset, and sometimes the people that I work with in my clinic, they don't have any particular stressor in general, aside from their ability to fall asleep or even stay asleep. So if this sounds like you, please note that there are treatment options that can help. So let's talk about them. How to start getting better sleep during midlife. Well, research shows that if you have a positive mindset and you make a few adjustments, it really can help improve the quality of sleep. So note, there is light at the end of the tunnel. So talk to your doctor to see if you are a candidate for hormone replacement therapy, or sometimes we call it menopausal hormone therapy. It really can help with those hot flashes. Sometimes it can help with mood. If you are a candidate for it, maybe something to consider. If you're not, or if you're not interested in that yet, you know, there are certain lifestyle factors. Make sure you're exercising on a regular basis, you're reducing your stress. Sometimes the things that you eat, like spicy foods, caffeine, or alcohol, may also really disrupt your sleep. And if you've already tried some of those things and you're looking for more of a deeper approach or a different approach, consider cognitive behavioral therapy. There's a great book that I recommend to the patients I work with. It's called Say Goodnight to Insomnia. And it's really great because some of the research shows that learning about sleep can actually improve some of the menopausal symptoms and you can feel better as well. So it's called Say Goodnight to Insomnia. It's cognitive behavioral therapy for sleep. I hope you found this information helpful. If you haven't signed up yet to be a Sleephoria Insider, that's just our weekly newsletter. You'll get valuable information about women's sleep health delivered direct to your mailbox. The link is below. Until next time, ladies, sleep well.